Hi, I'm Dr. Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. As you all know, Wave 2 is upon us. We're seeing this worldwide in the United States, across Canada, and in Ontario. And as we approach the end of November and winter's in front of us, it snowed last night, this is going to become more and more difficult. The government of Ontario has a colored scheme for where health units fall, and they have 5 categories. We are currently in the prevent and protect category. I like to say we're in both because you can have 10 new cases per week per 100,000 population. And frankly, if we have less than 10 in Renfrew County, we're lucky. Sometimes we have a few more, and hopefully we don't go beyond that. However, our neighbors in Ottawa are in the restrict area. They're having many more cases. And Toronto and Peel were in the red area, but as of yesterday, they are in lockdown. So this is serious. And in Renfrew County, as for Wave 2, we had 48 cases in October, our worst month ever. And we're not quite sure what November is going to look like. But as I said, it's becoming more and more difficult with winter and as we need to move inside. Now, I think my key messages today are keep your bubble to a minimum, your household, your work, and your school. And if you can distance work, all the better. Keep your social outings to the basics, shopping, the essentials. And if you are close to people, think of distancing and think of masking and also hand sanitation. But equally important is if you have any symptoms, and there's a list of symptoms, I won't go into them, but pretty much anything can mask COVID. We have those symptoms available for you on all our printouts and on our website. But if you have symptoms, take them seriously. Get tested. And if the health unit has told you that you are a contact of a case, isolate yourself and get tested. And in fact, now we have a Section 22, a law where we can require you or by law to isolate yourself. And if not, there are fines associated with this. So please keep ahead of me. We don't want to have the knock on your door with the law. We want you to cooperate and comply and help yourself, your family, and your fellow citizens. Now, I want you to take a look at something here. Here's another graphic. We had a workplace outbreak in Renfrew County some weeks ago. And this is an example of how the virus travels, how it comes into a community and how it leaves, and the devastation it can wreak. So here you have on this graphic, you see someone came in by car to Renfrew County. They were distance working and they came into a workplace 1 day a week and they brought COVID with them. And it infected 6 people in the workplace, and those 6 people took it home, and it infected an additional 6. And eventually it got into schools, and it got into other social gatherings. And what we see here is we had 18 cases that tested positive. We had nearly 200 people that had to isolate and be tested. Imagine the loss of time and the inconvenience. And we had, as you see, the workplace outbreak, which disrupted work activities, but also 2 schools with outbreaks. So there was an enormous loss of time for almost 200 people and 18 cases. And also think of the work that does, what that means to the health unit, the amount of work we have to do to aggressively follow up on all these contacts and cases. And it didn't end there, in fact. There was another social gathering that went outside of the county. It went back to the greater Toronto area, got into a family of 3, 1 was infected, and then got into a daycare. And again, there were some more infections. So this is what happens with COVID, and this is why it is extremely important to maintain your bubble, to keep it to your household and a bare minimum of contacts at work or at school. And if you can't do that when you're inside, you must distance and mask and follow the proper hand hygiene requirements. So important. And of course, if you are a contact of a case, you have to follow the health unit directives on this and also help us to understand who your contacts might be. So this is extremely important. And I think another message I have too is, look, this disease can mask anything. It has a variety of symptoms, but if you have anything from a runny nose to diarrhea or a cold or a cough or fever or weakness, it's COVID until proven otherwise. It might not be COVID, but we can't take a chance. So please do not ignore any symptoms and get tested. Phone VTAC and get tested if you have symptoms. I mean, for you to bring a runny nose or a sore throat or a fever into a workplace or to a school is inexcusable. We can't have that kind of behavior. So please, as I've said before, you're the offense as we fight COVID. To date, we've done a good job. We all have COVID fatigue and winter's coming, but we have to really knuckle down. We have to do our best to ensure that we can protect ourselves and preserve the economy throughout winter. We've seen what's happened in Toronto. We don't want that to happen here. And we have to get through this long and difficult winter. And there's good news now. A third vaccine, even today, has yielded positive results. And we all hope by late spring and summer that we can get vaccinated. But in the meantime, we're counting on you to do your best because you are the foot soldiers in this war against COVID. Thank you.